I am Nikita Upadhyay, Assistant Professor, Index Institute of Pharmacy, Malvanchar University. Topic Today is my topic name Angina pectoris. Angina is the result of myocardial ischemia caused by an imbalance between myocardial blood supply and oxygen demand. It is a common presenting system, typically chest pain among patients with coronary artery disease. Type of chest pain, precursor of discomfort. Insufficient blood flow to the heart muscles from narrowing of coronary artery may cause angina chest pain. Types of angina. Angina is classified broadly as stable or unstable depending on its pattern to occurrence and severity. एक रिवर्सिबल एंजाइना होता है, एक प्रोग्रेसिव एंजाइना होता है. फॉर्म इंक्रीज्ड डैमेज ऑन हार्ट associate with heart attack. Types of angina. A stable angina occurs when increased physical activity. Example: hurrying across a street or climbing a long stairs, which creates a greater demand for oxygen-rich blood to reach heart tissue. Unstable angina occurs with lesser degrees of excretion or while at rest. Unstable angina that occur at rest is the most serious formation of a blood clot at the site of a ruptured plaque in a coronary artery. Pathophysiology. Myocardial ischemia develops when coronary blood flow becomes inadequate to meet myocardial oxygen demand. This causes myocardial cells to switch from aerobic to anaerobic metabolism with a progressive impairment of metabolic, mechanical and electrical function. As diet have so then adenosine may be the main chemical mediator of original pain. During ischemia, ATP is degraded to adenosine, which after diffusion to the extracellular space cause arteriolar dilation and anginal pain. Clinical presentation. Angina is symptom of ischemic heart disease. Episodes of stable angina typically are brought on by excretion or emotions are relieved with rest. An attack of stable angina lasts from 1 to 5 minutes and is described as squeezing, choking, smothering or crushing pressure in the chest. Angina pain may radiate to shoulders, arms, back, neck or jaw. Patient with atherosclerosis also may be experience sweating, shortness of breath. A type of temporary chest pain, pressure of discomfort. narrowed artery ischemia, heart muscles, enough oxygen due to a narrowed coronary artery, typical distribution to referred pain. Diagnosis. A diagnosis of stable angina is based primarily on symptoms such as chest pain. A diagnosis of unstable angina is made when there is new onset angina that is severe and frequent. Chronic stable angina who develop more frequent, severe, prolonged, or more easily triggered episodes angina at rest. Diagnostic test and procedure. Electrocardiogram. It detects and records the electrical activity of the heart. Certain electrical pattern that the electrocardiogram defect can suggest whether CAD electrocardiogram is likely. However, some people with angina have a normal electrocardiogram. The electrocardiogram is usually normal between attacks. During an attack, there may be a transient ST segment depression. If the angina is provoked by excretion and exercise stress, ECG should be performed. डायग्नोस्टिक टेस्ट प्रोसीजर इलेक्ट्रोकार्डियोग्राम है ये एसटी सेगमेंट है डिप्रेशन का और ये है MSEC 18 नॉर्मल एसटी सेगमेंट है ये डायग्नोसिस टेस्ट एंड प्रोसीजर 2 state electrocardiogram testing. Typically this test involve taking electrocardiogram before, during and after exercise on a treadmill or stationary bicycle patient who are at risk for coronary event with exercise are instead given a drug to increase the heart rate. Coronary angiogram is obtained by injecting contrast material into the blood stream and taking X-ray of the coronary artery. This enables to physician to see blockage, malformation, and stenosis in the vessels. Blood test check the levels of certain fats, cholesterol, sugar, and proteins in blood. Abnormal levels may indicate risk factor for cardiogram. Some studies suggest that high levels for CRP, C-reactive protein, in blood may increase the risk CAD and heart attack. Goals of treatment. All treatment for people with coronary artery disease have the same goals: to decrease the effects of the disease on the quality of life and alleviate symptoms, to reduce mortality due to CAD progression. Currently, there are three main types of or drug used: nitrates, beta blocker, calcium channel blocker, nitrates or beta blocker are usually preferred for initial treatment of angina, and calcium channel blocker may be added if needed. Nitrates Nitrates improve blood flow, the relaxing and dilating veins and artery, including the coronary artery. Example: nitroglycerin and isosorbide dinitrate. Side effect: the most common side effect of nitrates are headache, lightheadedness, flushing, and an increase in heart rate. Beta blocker reduce the heart rate, blood pressure, and the force of contraction therapy, decreasing the amount of oxygen the heart requires to pump blood. Examples: atenolol, metoprolol, nadolol, and propranolol. Cardiac effect: worsens heart failure, bradycardia. Non-cardiac effect: constriction of airway, circulatory problems. Importance: hallucination, insomnia, and fatigue. Calcium channel blocker dilate arteries and lower blood pressure, which decrease the force of contraction. They also dilate veins, reducing the amount of blood returning to the heart, which reduce the workload of the heart. Examples: amlodipine, nifedipine, nicardipine, verapamil, and diltiazem. Side effect: flushing, dizziness, and lightheadedness, headache, peripheral edema, and depression of cardiac function with known dihydropyridine. Other measures in managing cardiac heart disease: anticoagulant aspirin. It helps to prevent blood clotting, keeping the narrowed arteries open and lowering the risk of heart attack. Treat high blood pressure, treat high cholesterol, quit smoking, lose excess weight, reduce stress, exercise regularly. Other treatment options: percutaneous coronary intervention, previously called angioplasty or balloon angioplasty. CABG, coronary artery bypass graft surgery. Atherosclerosis. Introduction: atherosclerosis, also known as arteriosclerotic vascular disease or ASVD, artery wall thickness build-up of fatty materials such as cholesterol, affecting arterial blood vessels. A chronic inflammatory response in the walls of artery due to the accumulation of macrophages promoted by low density lipoprotein without adequate removal of fats and cholesterol from the macrophages. Hardening or freeing of the arteries, formation of multiple plaque within the arteries restrict blood flow. This plaque can also burst, causing a blood clot, often considered a heart problem. Affect arteries anywhere in your body. Atherosclerosis is a preventable and treatable condition. Terms: arteriosclerosis, arteriolosclerosis, atherosclerosis, atherogenesis. Arteriosclerosis is a general term describing any hardening and loss of elasticity of medium or large arteries. Arterio arteriosclerosis is any hardening and loss of elasticity of arterioles, small arteries. Atherosclerosis is a hardening on artery specifically due to atheromatous plaque. Atherogenic is used for substance for process that cause atherosclerosis. Atherogenesis is the development process of atheromatous plaque. Atherosclerosis starts with damage or injury to the inner layer of an artery. The damage may be caused by high blood pressure, high cholesterol, and irritant such as nicotine, certain diseases such as diabetes. Epidemiology estimated 10-year risk of coronary artery disease according to various combination of risk factors level expressed as probability of an event in 10 years. According to United States data for the year 2004, for about 65% of men and 47% of women, the first symptom of atherosclerotic cardiovascular disease is heart attack or sudden cardiac death. Death within 1 hour of onset the symptoms. Epidemiology atherosclerosis is less prevalent in Central and South America, Africa, and Asia, and more prevalent is United States and Japan. The mortality is United States in 5 times higher than Japan. Pathophysiology atherosclerosis develops as a chronic inflammatory response of the arterial wall to endothelial injury. Lesions, progressions occur through interaction of modified lipoprotein, monocyte derived macrophage, T lymphocyte, and the normal cellular constitute of the arterial wall. The contemporary view of atherosclerosis is expressed by the response to injury hypothesis. Response to injury hypothesis. The following are the steps involved in the hypothesis: chronic endothelial injury, accumulation of lipoprotein, monocyte adhesions to endothelium, SMC proliferation, and EMC extracellular matrix production, factor release, platelets efficiency. Pathogen of atherosclerosis: hypertension, toxins in cigarette smoke, platelets adhesion, PDGF release, proliferation of myointimal cells, damage to endothelium, diffusion of plasma protein into intima, oxidation of LDL uptake, collagen synthesis, hemodynamic stress, LDL, migration of monocytes into formation of foam cells, cytokinin release, microphase of an artery that supplies the heart with significant atherosclerosis and marked luminal narrowing. Symptoms: atherosclerosis develops gradually, typically being severely atherosclerosis, and is usually found in most major arteries. No atherosclerosis symptoms until an artery is so narrowed or closed. Sometimes a blood clot completely obstructs blood flow or even apart and causes heart attack or stroke. Atherosclerosis symptoms depend on which arteries are affected. For example, atherosclerosis in heart artery have symptoms similar to those of a heart attack, such as chest pain, angina. Atherosclerosis in artery leading to brain have symptoms such as sudden numbness or weakness in your arms or legs, difficulty speaking or slurred speech, or drooping muscles in your face. Atherosclerosis in the arteries in arms, legs produce decreased blood flow is called peripheral artery occlusive disease. Have symptoms such as leg pain when walking. Sometimes atherosclerosis causes erectile dysfunction is man. Physiologic factor that increase risk. Various anatomic, physiological, behavioral risk factor or atherosclerosis are known. These can be divided into various categories: modifiable and non-modifiable. Modifiable having diabetes or impaired glucose tolerance, dyslipidemia, unhealthy pattern of serum protein carrying fats, cholesterol, tobacco smoking, increased risk by 200% after several years, having high blood pressure on its own, increasing risk by 60%, elevated serum C-reactive protein concentration. Physiological factor that increase risk: non-modifiable advanced age, male sex, having close relatives who have had some complication of atherosclerosis, cardiovascular disease, stroke, genetic abnormalities, example family hypercholesteremia, leisure of uncertain, being obese, in particular central obesity, a sedentary lifestyle, postmenopausal estrogen deficiency, high carbohydrate intake, elevated serum levels of triglyceride, elevated serum lipoprotein concentration, stress of symptoms of clinical depression, hyper hyperthyroidism, elevated serum insulin level, short sleep duration. Complication: the complication of atherosclerosis depend on the location of the located arteries. For example, coronary artery disease, uh, carotid artery disease, peripheral artery disease, arms and legs, aneurysm anywhere in body, formation of bulge in artery. Test and diagnosis: doctor may find sign of narrowed, enlarged, or hardened artery during a physical exam that include a weak or absent pulse below the narrowed area of the artery, decreased blood pressure in the affected limb, wheezing sound over the arteries, heard with a stethoscope, sign of pulsating bulge in the abdomen or behind knee, evidence of poor wound healing in the area where blood flow is restricted. Test and diagnosis: blood lab test can detect increased levels of cholesterol and blood sugar that may be increase the risk of atherosclerosis. Doppler ultrasound: use special ultrasound device, Doppler ultrasound to measure blood pressure at various points along arm of leg. This measurement can help doctor gauge the degree of any blockage as well as the speed of blood flow in the artery. Ankle branchial index. This test can tell if one have atherosclerosis is the artery in your legs and feet. Doctor may compare and blood pressure in ankle with the blood pressure in the arm. This is known as the ankle branchial index and abnormal differences may indicate peripheral vascular, which is usually caused by atherosclerosis. Test and diagnosis. Electrocardiogram. An electrocardiogram records electrical signals as they travel through your heart. An ECG can often reveal evidence of the previous heart attack or one that is progress. Angiogram to better view blood flow through heart, brain, arms or legs. Doctor may inject a special dye into your arteries before an X-ray. This is known as an angiogram. The dye outline narrow spots and blockage on the X-ray image. Other imaging tests. Doctor may be use ultrasounds, computerized tomography, CT scan, or a magnetic response angiogram to study the arteries. This test can often show hardening and narrowing of large artery as well as aneurysm and calcium deposits in the artery walls. Treatment and drug. Lifestyle changes such as eating healthy diet and exercising are often the first line of defense in treating atherosclerosis, but sometimes medication of surgical procedure may be recombinant as well as various drugs can slow or sometimes even reverse cholesterol medication aggressively lowering low density lipoprotein LDL cholesterol. The bad cholesterol can slow, stop, or even reverse to build up of fatty deposits in arteries. In arteries, boosting your high density lipoprotein cholesterol. The good cholesterol may help to cholesterol medication includes drug known as statin and fibrates. Treatment and drug. Antiplatelets medication. Doctors may prescribe antiplatelets medication such as aspirin to reduce the likelihood that platelets with clumps is narrowed artery form a blood clot and cause further blockage. Anticoagulant. An anticoagulant such as heparin or warfarin can help thin blood to prevent clot forms forming. Blood pressure medication to control blood pressure such as beta blocker, angiotensin converting enzyme, ACE inhibitors and calcium channel blocker can help slow the progression of atherosclerosis. Treatment and drugs. Other medications such as diabetes, leg pain during exercise are prescribed. Symptoms or a blockage that threatens muscles or skin tissue survival. You may be a candidate for one of the following surgical procedure. Treatment and a drug. Angioplasty. In the procedure, your doctor insert a long thin tube catheter into the blocked or narrowed part of your artery. A mesh tube stent is usually left in the artery to help keep the artery open. Angioplasty may be also be done with laser technology. Endarterectomy. In some cases, fatty deposit must be surgically removed from the walls of a narrow artery. When the procedure is done on artery in the neck, the carotid artery, it is known as carotid. Treatment and drug. Thrombolytic therapy. If you have an artery that's blocked by a blood clot, your doctor may insert a clot dissolving drug into your artery at the point of a clot to break it up. Bypass surgery. Bypass surgery to a doctor may create a graft bypass using a vessels from another part of your body or a tube made of synthetic fabric. This allows blood flow to around the clot. Lifestyle and home remedy. Lifestyle change can help prevent or slow the progression or atherosclerosis. Stop smoking, exercise most days of the week, eat healthy food, manage stress, manage the condition of high cholesterol, high blood pressure, diabetes, or other chronic disease. Thank you.